Hello, my name is Troy Roach. I am a citizen scientist studying low-dose nicotine patches for long COVID, ME/CFS, and other similar diseases. Today, I'm interviewing Erica. She is a registered nurse from Florida, I believe. Is that correct?
Yeah.
Okay. But of course, anything we say here is not medical advice. We're just two patients sharing our experience and hoping to help other patients with their long COVID journeys. Okay, so Erica, could you introduce yourself?
Yeah, my name is Erica Kravit. I live in Florida. I'm 42 years old. I'm a nurse practitioner. I practice, I see patients. I also teach adjunct faculty. Obviously, the working has been very up and down since I got long COVID in summer of 2024.
So actually, for you, it hasn't been actually so long per se. Or for me, it's been more than almost 6 years.
It's my second time, but
Yeah.
it's completely different than the first time I got long COVID.
So you had long COVID in the past.
Yes, but never nothing like this, and never where I needed to see specialists and go to a long COVID clinic. Like the first time I got it was in 2021, and it was completely different. It was um different treatments, different symptoms. The fatigue was not like this. I didn't miss work, things like that. Like this has been a very different ride.
Yeah, very different. So how did you hear about the nicotine patch? From a doctor on the internet, or where did you hear about it first?
So I got really sick, and you get very desperate when you're bedbound, homebound, and not working. And I started reading, and I found Mayo Clinic has like a patient chat, and somebody was writing about nicotine, and then other people were writing that was amazing. It worked for me. And then they wrote about the study that they based it off. I was like, I have nothing to lose at this point. I'm literally bedbound. And I said, I'll give it a try. And I did Amazon, shipped it to my house, and I just slapped on a patch and I said, I need to get better.
Yeah. And so what dose did you start with?
7 milligrams.
7 milligrams on the first day.
Yeah, like that's what I read. That's what I read. And from my experience, I would probably start lower, even though I know in the study they did that. I'm on 7 milligrams now, and I think it's a great dose for me. But I went back and started slower and moved up. But I will say, like I did write down how I felt before, and then I didn't write in numbers, like out of 10, how I felt after, but I did journal how I felt on like day 4 and 5, and it was like life changing. So I've been on them since January of 2025, almost consistent. Like I would forget to apply them, or I would think I needed a break because I thought that it was that, but it was actually something else that was causing me to feel a certain way. I even had one doctor at a long COVID clinic say, "Why are you off them?" And I was like, "Oh, because I'm doing a detox." And she's like, "You need to go back on the nicotine patch."
Interesting.
So,
Yeah.
yeah, right.
So if you could do it differently, so you would start at a lower dose from day one, because
Yeah,
7 was too much on the first day.
yeah.
And also, would you have taken those breaks from the nicotine patch?
I would not have taken the breaks because then you're going to kind of start over again, tapering up. If I could have done it differently, I wish somebody would have told me about nicotine patches because I really think they literally got me out of bed.
Mm-hmm.
They got me. I remember writing in my journal and going back to read that I would write brain fog, feel dumb, can't finish sentences, and I believe I put like 8 out of 10. And by day 5, I wrote finishing sentences. Brain fog is lifting. I feel clearer. So like the neurologic part was so big, and the fatigue was improved a lot. So I wish I would have started nicotine before all the things I tried. I mean, when you're desperate, you try anything you read. The detoxes, I did, you name it, I tried it. I did go even to see true COVID doctors and completely different experiences. So I wish I would have known before. And so I think it's great that you're doing this research, and I hope more people learn about it because it's accessible. It's not expensive. I actually found out I've been hospitalized many times since I got long COVID, and when I added it to my medication list, the hospital nurse came and put my patch on, and I was like, well, that's interesting. So it must be covered by my insurance. So then I actually had my doctor prescribe it, and it's covered by my insurance. I pay $0.
That's good to know.
Yeah,
That they're
the
covering
same
it as
brand
a
I like.
treatment for long COVID for you. Yeah.
Yeah, I've experienced also the difference in brands because when I first got the insurance covered one, they sent me a brand that wasn't the one I like.
Hmm.
And there is a change when you change brands. I definitely have read people say that, but I definitely felt it.
So what is your experience with the different brands?
The energy you get is a little less
Hmm.
depending on the brand.
And
I've
which was
read
the first brand that you used?
Habitrol.
Habitrol. Okay. So Habitrol is, I think, the same as rugby patches for people that don't. I think they're manufactured in the same place.
Possibly. I'm trying to think what the same appearance of the nicotine patch, the prescription one, I think I'd have to look it up, but they say it's identical.
Hmm.
I feel better than the ones that are clear. These are like skin tone.
Hmm. Okay.
I had the pharmacy change it to exactly, the one I wanted.
Yeah. So when you say that they're different, do you feel that one is stronger than the other one? Yeah.
I just feel a overall sense of well-being, more energy, clearer. I think that the Habitrol or the one I think it's called Dr. Reddy, if I'm not wrong, the one that's the pharmacy from Amazon dispenses it. It's more all day, like the release is more, I don't know, it's not up and down, kind of more steady. That's how I feel on that one. And I know other people like other brands, but for me, that's what works the best. And for the longest time, I would place it in one spot and then I would try different spots and I would have different feelings. So I kind of learned, to, like I always say, listen to your body. And I would read people say, try this spot. And I would be like, okay, well, and then it would not be for me. It's too strong for me.
Hmm.
And I did learn, like, try your foot if, like, it's a day that you're maybe too, I don't know, like you're already too hyped up or something, or like I had just had surgery and I was like, maybe I don't need that much stimulation. So I try my foot.
Hmm.
So I've learned a lot about nicotine patches just trying on myself.
So which parts of the body work for you or work better for you?
Almost this whole time I do my arms. I alter the sides, but I had tried a long time ago, like the spinal area, shoulder, scapular area, and it was too strong. But about a week ago, I decided to give it another try because I've been feeling better. I'm doing hyperbaric, so I feel like my baseline has improved. And I said, let me try again. And I actually am doing well with it, kind of behind my neck.
Okay. That's
But
interesting.
it's not for everybody because it definitely wasn't for me. At one point, I felt very revved up and just more side effects. I would say, like, when you start, some people start on the foot just to like not have as many side effects, and I can understand why.
Yeah. You can regulate, I guess, the dose and how the dose is getting into the body by patching in different areas. Basically, the further away from the heart or the head, then the slower the dose will be coming in. Also, if it's on more fatty tissue, it's going to be slower as well.
Yeah, and like I'm sensitive. Not everybody is sensitive, and since I got long COVID, I've had multiple surgeries and hospitalizations, and there were just times where I was like, you know what, I'm going to put it on my foot. I'm going through enough. So it's a good trick to know to just put it far away
Hmm.
sometimes, but I
Yeah.
wouldn't take a break from it.
Hmm. Yeah. I guess another way is to maybe use it a fewer hours per day, or maybe, reduce the amount some days. That's okay. Or some people, it bothers their sleep. Do you wear it 24 hours or,
Yeah.
yeah. Does it
I've tried
affect your sleep?
No, I've tried
No.
taking it off early to see if it changes. Like I check I use the ring and I check my HRV and I definitely check all my like my sleep patterns and all that. And I thought, well, maybe I should take it off early because this day I'm having whatever symptom. And it was never the nicotine patch. It was actually like sensitivity to either a new vitamin or I became allergic to more and more things or sensitive, with MCAS. So I would always try and take the patch off or take a break. And it was never the patch.
Hmm. Yeah.
And then I noticed how much my body really did well on the patch when I took a break. And my HRV would always climb up when I was back on the patch. So my autonomic system, I think, relies heavy on the patch right now because I'm working to build a better baseline. Because at one point I was bedbound with a very low HRV, and I'm trying really hard to build back up.
What do you know what your lowest HRV was?
I
Or
want to
your
say it was
lowest
like
percentage?
10.
10. Oh. And now what is it at? Do you know more or less?
So I hit like a lower, like 25 this week because I had a crash, but I was getting up
Mm.
to 35.
Mm-hmm.
Hyperbaric is, I started hyperbaric about a month and change ago, and it's not easy. Like it does stimulate your immune systems. It's not a walk in the park, but it's not the hardest thing either, but it does affect my HRV. Sometimes it'll make me have a small crash, but it hasn't dropped my HRV to like 15 or anything, but it was climbing, and then it'll take some dips. But
Yeah.
I think overall I'd like to get back into the 30s and stay steady.
Yeah. And the with the H-bot, did they say anything about the nicotine patches? Like you should wear them or not wear them, or it didn't matter?
For the hyperbaric,
Yeah.
they don't say anything. And I noticed like most places are not judgmental about the nicotine where I thought they would be. I only had like one encounter where I don't know if it was really judgment, more like a doctor who just didn't know, and I had to guide her through my lab results because
Mm-hmm.
I tested like a functional doctor, MD, and we did all these tests for like neurotransmitters, and my dopamine was high. Everything else was low. I didn't figure out why. And my neuroepi was high because, long COVID, you have high heart rate and all that. My dopamine should have been very low because at that time I was so sick in bed and all that. And I thought about it for a little, and I was like, it's the dopamine from the nicotine probably that's keeping me happy or out of bed or like able to go to work a few hours a week. And she was like, I'm going to read about that. I was like, you didn't know that it's used for long COVID? She's like, no, I never had a patient use it. And she's like, I'm going to read about it. And then she told me the following day, this is very interesting. I said, yeah, it's been very helpful for me.
Yeah. Yeah. That's good. That's good.
It was
And
cool
did
to
you?
see it in lab results, to see, like, dopamine high. I had, like, no serotonin, no tryptophan, like, everything was low,
Mm-hmm.
but my dopamine was high, so I thought that was very cool to see on paper.
Mm-hmm. Yeah. That's interesting. I don't know that type of. I don't think I've heard anybody mention that they're measuring the dopamine levels.
I've been to every kind of doctor, so I went to functional. I've been to long COVID clinics.
Yeah.
I mean, I was just desperate to get my life back in order. I can't say that I'm there yet, but I'm trying everything.
Yeah. Yeah. Okay. So, are there any other benefits or side effects of the nicotine patch?
I would just say, like, when you put the first one on, and if it's too high dose, the side effects for me, I was very ramped up, like, high heart rate that day. My stomach was not great. I couldn't leave my house. It was just too heavy. But once I cut it down, and started back over, I felt better.
Yeah. And have you had any other negative side effects since then?
Not, no, not
No.
not negative side effects. No.
No. Okay. Oh, that's good to know.
Yeah, no.
And do you normally start patching early in the morning, or do you start patching at night?
I patch in the morning, and I try to do it like with my blood thinner, which is an injection. So I make it like my routine every morning. My memory is definitely better, but there are times I forget. And then I'm like, oh my God, it's like late morning. I have to go back and do it. But I'm pretty consistent at like 8 a.m. I do it.
And well, so what other treatments have you tried? You mentioned that you're doing the hyperbaric now,
Yeah.
which can be taxing because it kind of many people don't know about like the reperfusion
Yeah.
injury that you get as well. And it
It's in the
takes a lot.
time that you have to dedicate and the money
Hmm.
and the rest after would just like, I don't know, it's hard to. rest when you're trying to get things done that you couldn't do before, you know?
Yeah.
Hyperbaric was recommended by a long COVID doctor, and I was leaving it for my last option because I was doing all these detoxes. I did Ebu, I did all those, I did a IV detox, glutathione, ALA. It was too strong for me. I've done ozone. A lot of IVs, red light. I'm trying to think. I did LDN, which was very good, but I've had, again, so many surgeries that I can't seem to get back on it because then
Hmm.
you have to get off it before surgery. I tried a lot of repurposed drugs or, some drugs that they don't like to talk about here. That was, sort of like, well, and blood thinners. The blood thinners, I started with aspirin 81 and then I went up to 325 and eventually I ended up on Lubinox because of surgery and it really helped with my body aches. But I have abnormal clotting factors from COVID.
Hmm.
So
Yeah.
it would make sense that like my muscles weren't getting all the blood I needed. So that was a big game changer for me was even the baby aspirin was helpful.
Yeah. Yeah. I eventually was able to get on baby aspirin, but nothing stronger than that. But now I actually noticed recently that if I cut, then I actually bleed like normal, which is, I wasn't used to that. I was like, wait, there's actually blood coming out. It's not stopping.
Yeah, I mean, and it's you probably feel a little better, right? Like
Yeah. Yeah.
at some point, I don't know if you noticed, but my toes were purple looking, and the bottom is like towards the bottom of my legs were like a darker, like I was not perfusing very well for sure. The hematologist didn't want to thin my blood, but I read a study of somebody my age who they did like aspirins, and I was like, well, that's not really what I want to do. I don't know. So I thought about it, and it was an accidental like thing where I was in the hospital. Pre-op Lovenox was given, and I was like, "This is weird. My body doesn't hurt for the first time in a long time." And then it happened again and again. So, because they prescribed it for a month, and so I've just stayed on it, but my numbers haven't changed.
Are you taking anything like nattokinase or lumbrokinase or NAC to
Right.
help break down the?
I did all that, and my spike protein didn't move at all. My spike protein didn't move with any of the treatments I did. It maybe moved a few points after a very heavy ALA glutathione detox I did that put me in bed. It was too heavy, very, very strong. So nothing has really moved my spike protein in the detoxes and all that. Even ozone, even chelation I tried. Um, Forgot about that one. Yeah, I've tried a lot. So I'm hoping hyperbaric, and then I've thought, go back on LDN and consider upping nicotine. But right now I've been good on 7, but it is something to think about.
Yeah, yeah. So at your worst, I think before you said at your worst you were at about 30% maybe functionality, and now you're at, you said 80%.
I work. I definitely drive. I used to drive and get lost. I don't do that anymore. I work a few times a week and I work online. I used to miss my own course, which was horrible. My memory was so bad. So I'm better now with that. Like my memory's improved. And I think nicotine helped a lot with being a sharper. My social life has improved, but it's not, I don't know if it'll ever be like when I was younger. Like I don't exercise. I don't stay out very late. It's more because I'm trying to protect and rest because I don't want these crashes because I do get like a PEM crash. So I'm just trying to avoid that.
Yeah, that's good because each time you crash, then it takes 10 times as much rest to get back.
Yeah. And it's to get like really bad leg pain
Mm,
for some reason. And I don't want that. So I try to protect and socialize a little, because I do, I am a mom. That's a lot of work. So I put my energy where it needs to be. And I know I have X amount of energy to give. And the hyperbaric right now is taking up a lot of my time because I go about every other day if possible. And then
mhm.
I need to rest.
Yeah. Well, so what other treatments other than nicotine would you recommend to people to try? Is there something you're like, oh yeah, definitely try this other thing?
Think LDN. I think LDN for me was I noticed changes. I think that aspirin is something people should look into. And I think it, depends. Obviously, if they test, with some kind of abnormal coagulation or not, I think aspirin still helps. And I know that they are repurposing drugs and some people benefit from that. And there is a company in the United States that it's a doctor who cured himself with a repurposed drug, young guy, and I don't know if he's doing anything for long COVID, but I hope he does, because he's doing, a lot of repurposed drugs for different illnesses.
Yeah.
I would say those are, the biggest things that have changed my recovery, and, you know, it's not like up, up, up recovery. It's got its ups and downs, but nicotine is pretty stable. LDN was very stable. For POTS, electrolytes, for sure. Compression socks. But not everybody has POTS, if you do.
Well, I think even without pots, I think electrolytes are important for long COVID because and also it's one of the things that we actually suggest with the nicotine patch is to make sure people stay hydrated and they get electrolytes, magnesium, potassium, etc. Because the effects that it has on the system, your body needs to be able to move more fluid around.
Makes sense. So yeah, I do a lot of water, a lot of electrolytes, and coconut water. That was something I never did before I got sick. Coconut water, I wasn't into it. But it has potassium, which every time I was in the hospital, I would drop potassium. So coconut water was something I started just to keep my potassium, and I do add electrolytes to it. So it works for me. It's been helpful.
All right. Thank you very much for coming on and talking to us and telling us about your experience. So far, mostly good with the nicotine patch,
Very good.
which is
Thanks
great.
for having me.
Yeah. And maybe later when you're completely cured and back to life at 100%, we can do another interview and see how it's going.
I hope so. I would love that.
Yeah. Yeah, me too.
Yeah, I hope so for you too. Nice to see you.